Hey guys, I'm going to be talking to you about the osteology of the hip and also the knee joint. So first starting with the pelvis bone, which is a bone that is fused by three different bones. You have your ilium, your ischium, and also your pelvis. And then they all join together at the acetabulum, which articulates with the head of the femur. But here I have a right pelvis and also a left femur, so I can't really show you the exact articulation. But main gist is that the ball go into the socket and then create a ball and socket joint. And distally, the femur, again, you have the head, neck, greater trochanter, lesser trochanter, the shaft, and then distally you have the two femur condyles. And then what it does is that it forms a knee joint with tibial. So you have two tibial condyles, and this is your tibial tuberosity. And the two condyles from the femur and the tibial forms a bicondylar synovial joint. And that joint is actually reinforced by a lot of ligaments. There are two collateral ligaments and then two cruciate ligaments. Mainly. So we're going to start by the cruciate ligaments. So the cruciate ligaments, there are anterior and posterior cruciate ligaments. Anterior, it starts from your anterior tibia and then goes to your femur condyle like so. So what it does is that it prevents a anterior displacement of your tibia like this, right? So if your tibia wants to go forward, it's not going to go forward because of this ligament. And then the posterior is the same. It just prevents posterior displacement, and it's attached from the posterior side of your tibia to your femur condyle. And then next you have the collateral ligament, medial and lateral. So first the medial. Okay, medial. So first the medial collateral ligament, it attaches like so. What it does is that it prevents a force that comes from the lateral side. It prevents a varus force, and therefore it prevents an abduction of your knee joint, right? And then your lateral collateral ligament, it comes from your femur condyle to your fibula. And what it does, it prevents a force come from the medial side, which is a valgus force. And what it does is that it prevents an adduction, And the next are menisci. So the menisci, you have two, which are basically two rings on your, in between your femur and tibial condyles. So what it does is that it absorbs shock. And then for movement, what it can do is that it can flex and extend. It can also externally rotate and then internally rotate. It can also abduct and also adduct. And for a knee, it's mainly flexion and extension, and there are somewhat rotation to that as well that is made possible by the cruciate ligaments.